All right, so now let's continue on and look at blood flow through the heart. And so when we look at blood flow, we have to remember that the right side is going to be deoxygenated blood, and then the left side is going to be oxygenated blood. Okay, so here we have an example of, here we have our left side. And so again, the left side is going to be now oxygenated, and then the right side is going to be deoxygenated. So if we start at number 1, what we have is blood that goes from the right ventricle, and then it's going to enter into the pulmonary circuit, okay? And so it's going to go to both of our lungs. And so this is where we have the exchange of carbon dioxide for oxygen now, okay? And that has to do with all those hemoglobin molecules that we have on our erythrocytes, and then that are going to be innervated and surround the alveoli of the lungs. So now we have oxygenated blood that is going to come back towards the pulmonary, or via the pulmonary veins, and so these are going to expel their blood into now the left atrium. The left atrium is going to then go through the left AV valve, and then we'll go to the left ventricle, where now this oxygenated blood is going to go out into the system. And so this is the systemic circuit, okay? And so it's going to go both to the upper extremities as well as to the lower extremities through a series of different blood vessels. And then with the capillaries, what we find is now the exchange for carbon dioxide for oxygen. And so, or I'm sorry, for oxygen exchange for carbon dioxide as metabolic waste. And so that deoxygenated blood now is going to come back through the respective vena cavas and then into the right atrium, where that's going to go through the right AV valve and then go through the right ventricle, and the process will continue all over again. And so here's just a better view. So here we have, again, blue is going to denote deoxygenated blood. So here it's coming from the systemic circuit and going to dump both from the upper extremities and lower extremities into the right atrium, where it'll pass into the right ventricle and then up through the semilunar valve of the pulmonary trunk and enter into the lungs, where it can have the exchange of carbon dioxide for oxygen now. And then so when it comes back, now we have a loop that has this continuous, and oxygenated blood will come back through now the pulmonary veins, where it will dump into the left atrium, and then will go into the left ventricle, where it will go out into the aorta. From the aorta, it will go on to several vessels into the upper extremities and lower extremities, and then circulate and then come back through the different vena cavas, and then ending again into the right atrium. Now, blood flow for the heart itself, we have a different supply for the myocardium. And so this is termed coronary circulation. So the heart has to receive its own blood, most of which happens during a ventricular diastole. So the venous blood is returned to the right atrium, and then the arteries off the aorta are where we find several of the coronary arteries as well. And so these different arteries and veins are going to wrap around the heart itself, so that, again, it has nourishment because of all the extra work that it is doing.